Oftentimes, providers will want to monitor a patient's heart in their normal circumstances. When that happens, it's called ambulatory cardiac monitoring. And ambulatory is defined by a patient that's able to walk around. So, easy way to be able to monitor that in their regular day-to-day activity, we use what's called a Holter monitor. A Holter monitor works very, very similar to an EKG. However, it is portable. And so it is tracking the rhythm and the rate of a patient's heart, and it's saving it into a device that we can then take and plug into our computer, and it's going to give us a rhythm strip, a printout. What changes here is the amount of time that the patient can wear this portable Holter monitor. So typically 24 to 48 hours. However, it wouldn't be abnormal to see someone wear this for longer periods of time. It is shorter in the lead, so there are only 5 leads that the patient will wear. And the instructions on the leads would be to keep those leads clean and dry and make sure that they stay adhesive to the skin. Now, when they're wearing this Holter monitor, they're going to continue with their regular day-to-day activity, and the machine is going to pick up any abnormalities or irregularities. The patient also has a responsibility in recording anything that they experience and can document. So they have 2 ways to be able to do that. The patient will be instructed to keep a diary. Any abnormalities or irregularities that they can feel, that they witness on their own within their heart, they're going to document in the diary. And in the diary, they're going to document the time that they've experienced it, perhaps what they were doing when they experienced it, and maybe give a brief definition of what it was that they experienced. Along with that, in the Holter monitor, it has what's called an event button. The patient will also press the event button on the Holter monitor when they're experiencing these irregularities. And what that event button will do is create a marker when we print out the rhythm strip. So it gives the doctor really important resources. Not only do they have the patient's perspective of what occurred, but they also have the Holter monitor's perspective and what it recorded, along with the event button or the line that will be created in the rhythm strip to represent any abnormalities that the patient or irregularities that the patient may experience throughout that 24 to 48 hours. So here we also have a definition of telemetry. And telemetry is identified by cardiac rhythm that's continually transmitted live to a monitoring station. We do have departments in the hospital that are identified as telemetry, and their primary responsibility is to continuously monitor live activity that's happening with machines such as a Holter monitor. Now, with Holter monitors, they do come in different variations here. You can see this one has a 3 lead. This is a 5 lead here, and sometimes the placement may change. The monitor itself, very small, can fit in someone's pocket, or we can connect it to a belt buckle. Very small, not an inconvenience. The patient's instructions would be keep the area clean and dry, but maintain regular activity. We are going to watch for indications of dizziness, possible fainting. And the monitor over time will detect arrhythmias that occur. Again, 24 to 48 hours, not out of the question to see this happen for longer periods. Here are the instructions for a Holter monitor. And we're going to instruct our patients to continue with their normal day-to-day activities. As I shared earlier, document any symptoms that occur in their log. Document activities in the log. If for some reason those electrodes do become loose, the patient has instructions to apply tape to make sure that the electrodes do stay in place. They are going to keep the area clean and dry. They'll have instructions on not removing any of the electrodes, not disconnecting any of the lead wires, logging all activities, and utilizing that event button if symptoms do occur.